77 WABC.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. I'm here with John Taransky. How are you, John?
I'm good, Doctor. How are you?
Hope you're all doing fine, having a great weekend. Coop is at the controls. He's in charge and managing us all, and Mike is assisting him. So if you have calls, we are live. I know it's hard to believe in this world of prepackaged.
Right. Everything's premeditated these days, but we are live.
Prepackaged, plasticized. We are live. We're just a few steps from our office, which is at 38th and Broadway. Again, it's Dr. Lederman. Our number is, what's our number?
800-848-WABC. 1-800-848-9222.
Right. So you're welcome to call in. I sometimes don't know exactly what we're going to talk about because things in medicine change so quickly.
Yep.
And last night I got this email, and I actually woke up at 4 o'clock this morning and read this email, and I was really so shocked. I thought it was one of the most important things I could talk about. So this is the email. It came to me 11 o'clock last night, and I'm going to read it to you. It says, "Hello, Dr. Gil. My husband was just diagnosed with prostate cancer on November 25th, so that's this week, and is scheduled for surgery on December 18th, 2013. That's just in 2.5 weeks. I'm very concerned because he's at high risk for the reason that he had triple bypass heart disease and now has stents in the heart. So he had bypass and stents. He also had abdominal aortic aneurysm stents done in January 2013. His wife goes on, please help me if surgery is his only option. I've heard and read information about your radiosurgery and other options. How can I convince my husband to have radiosurgery? I think out of frustration, my husband decided to have surgery. He says he wants it out. Please help me enlighten him about no open surgery, which is radiosurgery. Thank you, and her name." So it's actually an appeal. She's appealing at the last moment. He was just diagnosed. It seems strange that you get diagnosed this week and you're scheduled for surgery so quickly. I mean, who would want to have surgery 1 week before Christmas? I might say, who'd want to have surgery at all?
Right.
So why do I say that? Okay, so let's talk about this case and what this woman can tell her husband. And I'm sure there's some listeners out there that are in a similar situation. What's the truth about prostate cancer? Many people are led to believe that if you remove the prostate, you're home free.
Right. It's completely taken out. It's gone.
So if you remove the prostate, your cure rate should be 100%, right?
That's what I'm sure many people think.
But it's not.
Right.
Okay, so let's just talk about some of the so-called success rates or cure rates or 5-year cancer-free survival rates. We're going to really dwell on the correct terminology, which is 5-year cancer-free survival. What's the likelihood of being cancer-free 5 years after surgery? That's a pretty good margin to give you an idea of how the treatment's going to be. So if you went to the most famous surgeon in New York and had surgery, and maybe this man did,
Right.
and let's say his PSA was 4 to 10. It ranged from 4 to 10. PSA is a blood test, prostatic specific antigen. Usually less than 4 is considered okay. Excuse me. So you went to the famous surgeon, had your prostate removed. Your chance of success is not 100%. In fact, it's 76%. So a quarter of the men have already had recurrence of the cancer within 5 years, even in that relatively low-risk group, PSA 4 to 10. Now, if the same group of men came to us, and this is based on our statistics of thousands of men, I've been at this for many years, and we gave them our premier product, which is the brachytherapy and focused beam radiation, our success rate's 90%. So with surgery, 76%, with basically non-invasive treatment, 90%, we're 18% better.
Wow.
So if you have 200,000 men a year in America with prostate cancer, there's actually more than that, 18% means 35,000 lives saved.
Yeah.
So you're talking about huge differences.
Significant number.
Huge differences. And let's just say for this woman, your husband had a PSA 10 to 20, and you went to this famous surgeon, and he operated. Well, what's the chance of being cancer-free 5 years later? Any ideas? Give me a call if you have an idea. Well, the numbers are 69%. If you have a PSA 10 to 20 and you have surgery by one of the most famous surgeons in America at a big cancer hospital in New York City, your chance of being successfully treated is 69%. If you came to us, our program gives a success rate of 86%, which is 25% higher. And in the highest group, PSA 20 to 50, and that could be your husband, it's possible. If you had open surgery at a big cancer hospital in New York City, the success rate's 44% by the chief of the department. Can't go higher than the chief.
Right.
Okay, 44%. If that same person came to us with a PSA 20 to 50, our chance of success, and this is based on thousands of patients again, is 73%, which is 66% higher. So again, if you're looking at that same 200,000 men and 66% higher, you're talking about 120,000 lives saved.
Wow.
So number one, a good reason for your husband not to have surgery is it's not so good. It ain't what it purports to be. If you have your prostate out, you're not home free.
Yeah, sure.
In fact, just the troubles start. And what do I mean by the troubles start? Well, first of all, I've just told you that the chance of success is much, much less with open surgery than with our methods of focused radiation. Much less. Number two, your husband already has heart disease, vascular disease. He's had bypass surgery. He's had stents. He's had aortic aneurysm. Excuse me. There's a death rate with open surgery on the prostate, and the death rate is about 1%. Complication rates, heart attacks, strokes, about 5%. With us, that doesn't happen because we're not doing surgery, major surgery on the patient's prostate. And number 3 point is a recent study from a prominent medical school in Boston looked at quality of life issues. And in that study with 220 men who had open surgery and 400 men who had robotic surgery, only 19% had no problem with continence after open surgery. Only 13% had no problem with robotic surgery continence, which means that 80% to 87% of men after open surgery or robotic surgery had problems holding on to their urine.
Sure. Yeah.
And most men do not want to be urinating in their pants. They want to be urinating where they're supposed to be urinating, which is in the toilet. And the fact is that the majority of the men, if you ask the men themselves, are having problems holding their urine. And also, in the same study, and if you come into our office, I'll be happy to show it to you in black and white, about sexual function. If you have open surgery, only 2.9% of the men had no problem with sexual function after open surgery, and only 2.3% of men had no problem after robotic, which means about 97% of men had problems with sexual function, which means erections adequate for intercourse after surgery, whether it's open or robotic. And again, another patient came to me, and this was his surgeon describing the complications of surgery for prostate cancer. And I've read this before. I apologize, but for this woman and her husband who's scheduled for surgery in 2 weeks, I just want to go over not only is the chance of success less with open surgery, the quality of life is less with open surgery, and here's a risk of complications as written by the chief of robotic surgery at a big hospital in New York City. And I'm reading it. If you want to come into my office, I'll be happy to show you the letter. It says, quote, Mr. X was most interested in learning about surgery for his prostate cancer, in particular the robotic procedure. I explained to him the details of the operation and the anticipated post-operative course. Then I reviewed the potential short and long-term risks of surgery. These include, but are not limited to, infection, bleeding, positional injuries, deep venous thrombosis, pulmonary emboli, bowel injury, rectal injury, ureter injury, cardiac or respiratory problems, penile shortening, urethral strictures, incontinence, infertility, and impotence. And the most shocking of all is, and this is the man who's in charge of robotic surgery at this big hospital, he said, quote, lastly, I explained that while I prefer the robotic approach, there is no convincing study demonstrating clear superiority over either open or conventional laparoscopic prostatectomy. So there you've got it. For this lady, I think it's very clear what you can tell your husband. Number one, you don't need open surgery for prostate cancer. Removing the prostate doesn't guarantee a cure. In fact, the success rate being cancer-free is much less if you have open surgery than if you would come to our center. We have data over 20 years. We have data with thousands of men. We have data that I've personally taken care of these patients, and I would plan to offer services if it's appropriate to you. So there's lots of things to tell your husband, and deciding on surgery because you want it out is probably the worst possible decision. He has major risk factors. Even men who don't have risk factors can have those complications. And why wouldn't you want to go with the best treatment? The best chance to be cancer-free,
Yeah, sure.
The best chance to avoid surgery, the best chance to keep your sexual life, the best chance to keep your urinary life, and the best chance to live a normal life.
Right. I mean, makes sense.
So what else would you tell this woman who wrote me last night about her husband who made this decision to have surgery just in a few weeks, December 18th, week before Christmas?
I certainly think it's worth a call to your
I
office
think it's worth
and have a chat
a
with
call,
you.
spend an hour or two, go over the data, go over more data once we have the details of your exact age, your PSA, your Gleason score, and stage. So please feel free to call us. We're at 212-CHOICES, 212-246-4237. And the data that I quoted is in a booklet called Prostate Cancer Treatment that we provide at no charge to people. So you're welcome to call us. We'll send it to you at no charge with a DVD, and you can look it over, or better yet, meet in person. We're going to go to a station identification because we have the generous man with the golden voice.
That's right.
And we're right back to take your calls and to discuss other cases. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted.